Thanks, JCC. Just now, the latest edition of the world's most respected neurological journal, Brain, has published a study that has thrown the world of migraine specialists and scientists into total disarray. The breakthrough data proves for the very first time that migraine attacks do not in fact originate in the brain as previously thought. South Africa's migraine surgery pioneer, Dr. Elliot Shevel, is here to shed more light on the medical implications of this survey. Dr. Shevel, welcome. Thanks very much for being with us.
Thank you so much.
All right, so this is huge, obviously. I mean, this is a huge development. Why?
It's the most exciting development in migraine science for a long time, because most migraine specialists have believed that the pain comes from the arteries in the brain.
Right.
And these colleagues in Holland did some very, very high-tech measurements of the blood vessels in the brain during migraine and outside of migraine, etc. And they found there were absolutely no changes in the brain. And they have now absolutely proven that the pain doesn't come from the brain. And for us, it's very exciting, because this is what we've been saying for years and years.
Yeah. Where does the pain come from?
It comes from the structures on the outside of the skull. There are two structures mainly. They're the arteries, branches of what they call the external carotid artery, and they're the muscles around the head and neck.
Right.
And the exciting thing is that these structures one can actually get to. It's not that you have to now look inside the brain to get there. You can get to these structures. So what we're doing is we've developed surgical techniques, and that's the most exciting part. I was in Berlin last year visiting a colleague, Professor Mühlberger at Humboldt University, and we decided to actually start the International Association of Migraine Surgeons, and I predict that that will become the most exciting development in migraine, because once you do surgery, that's usually a permanent cure.
Yeah. Well, I remember having you on the program last year. I think it was around about July or so when you came through with this breakthrough surgery. What has this done now to your research, this finding?
Well, what we are doing now is we are refining the techniques, refining the diagnosis, but what it's done is it's brought us into the forefront, because this is what we've been saying all along. And it's actually destroyed any opposition.
Yeah. Now let's talk about this procedure that you're doing. And again, as I say, when you were on last year, Morning Live viewers went insane. They were phoning and emailing, desperate to get the number of where you do it, how it's done, what the costs are. How's it been? How have South Africans taken to it, and the success stories behind it?
South Africans have taken to it in a big way.
Yeah. And
not only South Africans. As I mentioned earlier, we have people flying in from all over the world to come and have the surgery here, which is the only place really where it's being done at present.
Yeah, and continuing, I imagine that this will now become even stronger now that this new research has come, and the rest of the world will be taking it more seriously.
Correct.
Yeah.
And there are other surgical techniques being developed as well, where we can do minor surgery really on the muscles that are causing the problem, if it's a muscular problem. So it lends itself to surgery now, whereas before people were looking for drugs to act in the brain, and it wasn't in the brain.
Are there no drugs that can actually eliminate this, migraines altogether? Is there anything that people are working on?
They are working on them all the time, but the problem with this is that it's not one thing that's causing it. It's multifactorial. Most people have, for instance, got a mixture of muscle tension and arterial pain. So if you work on a drug that is going to help the arterial pain, it doesn't help the other one. And there are other inputs as well from the other structures in the head and neck. Yeah. So it's not a simple thing like diabetes is a raised insulin, raised blood sugar. So you give the person insulin, it comes down. There's only one thing to treat.
Yeah.
This is a very complex matter. And the diagnosis is important.
At the end of the day, the only cure that you know of for migraines is this procedure that you do.
At this stage,
and
yes.
How do you find out? I'm actually just taking us back to last year, because I'm sure there are a lot of new viewers that have come in. How exactly does this procedure work that you do for people that suffer with migraines?
Well, if you examine a patient while they're having a headache, and you know where to where to compress the various vessels
Yeah.
that are usually causing them. If you compress the vessel with your finger and the pain goes away, and you take your finger off and the pain comes back, you know that that vessel is responsible for the pain. So, and now we are using what we call a CT angiogram to find all the vessels that might be involved and to measure exactly where they are, which makes the surgery even more precise. So it's moving at an alarming rate.
Yeah. Does it differ in people? For instance, I mean, if I come and see you and I have a headache or a migraine at this time and you press here and it goes away, but would this be the route for me the whole time, or would it change?
It changes.
So then would the procedure work if you perhaps do the procedure there and the next time I get it over there?
No, but what we do in the diagnosis is we test all of the arteries. Now, sometimes if one compresses an artery at the back of the head, the pain here goes.
Okay.
So one has got to examine all the arteries, and then when we do the procedure, we do all the arteries that are causing the problem.
Yeah, yeah. Well, let's get that number again, because I know people are they're so interested in it. Oh, apparently it's on the screen already. The Migraine Research Institute, it's 0861, it's too far for me to read, 678-911, 0861 678-911. And just finally, the year ahead for you, are you going to be doing a lot more selling of this surgery overseas?
As I said, Leanne, it's so exciting.
Yeah.
Now, I'm doing research projects with this professor in Berlin. We're doing a joint project with Professor Cianchetti in Italy, which is being funded by the South African and Italian governments. And possibly there'll be some Danish colleagues coming on board as well. So it's spreading.
Yeah. It's spreading and originating in South Africa. Well, thank you very much again, Dr. Elliot Shevel, for being with us and talking to us about this procedure. The number again, 0861 678-911. Let's take a break. When we return, Evita is in the house. Stay tuned.